Why does a hematoma cause significant swelling after surgery? Have you ever wondered why some patients experience noticeable swelling after surgery? One common reason is the formation of a hematoma. A hematoma occurs when blood leaks from damaged blood vessels into the surrounding tissues. This collection of blood can lead to significant swelling at the surgical site. When blood escapes from these vessels, it pools under the skin or within the area where the surgery took place. This pooling creates a localized buildup that physically expands the tissue, resulting in swelling. The increased pressure and volume from the trapped blood stretch the skin and underlying tissues, making the swelling more pronounced and sometimes painful. During surgery, tissues and blood vessels are inevitably injured. If these vessels are not completely sealed, bleeding can occur. The escaped blood forms a hematoma, which is different from normal swelling that results from fluid or immune responses. A hematoma is an actual mass of trapped blood that cannot drain away immediately, leading to tissue enlargement. Additionally, the body responds to tissue injury by increasing blood flow and immune activity to support healing. This response can cause even more swelling as additional fluid and immune cells gather at the site. If the lymphatic drainage is disrupted during surgery, fluid can accumulate, further compounding the swelling. In the case of a hematoma, the blood itself adds to this fluid volume, making the swelling even more noticeable. The swelling caused by a hematoma can also lead to discomfort and a feeling of fullness. You may notice visible bruising or discoloration in the area. If the hematoma is large, it can compress surrounding tissues, which may slow down oxygen delivery and delay healing. In some instances, the pressure from a hematoma can increase pain or raise the risk of infection since the pooled blood lacks a direct blood supply. For patients recovering from surgery, it is essential to recognize swelling caused by a hematoma. This condition may require medical attention. Small hematomas often resolve as the body gradually reabsorbs the blood over days to weeks. However, larger or expanding hematomas might need to be drained surgically to relieving pressure and prevent complications. Practical advice for patients includes keeping an eye on the surgical site for swelling that feels firm or fluctuates, changes in color, or increasing pain. It is also important to avoid activities that could cause trauma or pressure to the area. Following medication instructions, especially regarding blood thinners, is crucial. Always inform your healthcare provider promptly if you notice worsening swelling. In summary, a hematoma causes significant swelling after surgery due to the localized collection of blood that enlarges the tissue, combined with the body's inflammatory response to injury. Monitoring this swelling is vital for proper healing and to avoid further complications.